Well, it's something that's near and dear to our hearts, and that's helping people get the information and care they need to be healthy.
First Coast News has partnered with Baptist MD Anderson to help raise money for the Buddy Bus. The Buddy Bus is going to be a mobile mammography unit that goes around town, and it's going to provide mammograms to women who need them. This is a project that's huge, and we are really excited about it.
Absolutely. And part of that project is also sharing stories and knowledge with you at home. Joining us now is Dr. Beth Ann Lesnikoski. She's a breast program director at Baptist MD Anderson Cancer Center. Welcome to the show, Doc.
Thank you.
This is Breast Cancer Awareness Month, October. A lot of people think, hey, that means it's time to raise money, but you want people to be thinking about other stuff. What is that?
Well, I think the two most important things for a woman to know about breast cancer is two things. First is know your risk. Do you have an average or an elevated risk of breast cancer? And the second is know what your breasts feel like. Breast awareness is something that all of the major cancer organizations recommend for women to know what their breasts feel like and to report anything different to their doctor. The other thing is that screening and early detection still matter.
And early detection is very important. Is there anything that women can do to reduce their risk of getting breast cancer?
So there's two main things, diet and exercise.
Yeah.
It's very interesting because they work together, but they're also separate. So maintaining a healthy diet, low fat, high fiber, lots of cruciferous vegetables has been associated with a lower risk of breast cancer and with a reduction in weight. So getting to an optimal weight is going to reduce a woman's risk. Interestingly, exercise reduces risk even if a woman isn't able to lose weight with her exercise. So we've looked at breast cancer survivors, and those who exercise, regardless of their weight, have a better survival.
It's interesting.
It's important information. You just mentioned there, early detection is what truly can save your life with this disease. Talk more about the breast cancer screening process.
So most major cancer organizations like the American Cancer Society, the American Society of Breast Surgeons, the American College of Radiology are all still recommending annual mammogram starting at age 40. For a woman who has a family history, particularly of very young women in the family of getting breast cancer, then those women may start screening earlier, and they should also include MRI as part of their annual screening. So if a woman has a lifetime risk of greater than 20%, we recommend both mammogram and MRI as part of their screening, and we like to put them 6 months apart so the breasts are being looked at twice a year instead of once a year, but with different modalities.
And no two cases are the same. So what about women that have denser breast tissue? What are some of the screening options for them?
So dense breasts have been associated with an increased risk of developing breast cancer, and that's especially true after the menopause. So it's actually quite normal for women to have dense breasts when they're in their 40s. So if you get a report from your mammography screening area that says you have dense breasts and you're in your 40s, you're premenopausal, don't worry too much because that's actually pretty normal. However, dense breasts are both associated with an increased risk of getting breast cancer over time and make mammography a little more challenging in terms of detecting things. So the dense breast tissue can hide fine white calcifications and even masses. So when a woman has dense breasts, she should really be talking to her doctor about getting some additional screening. And that would typically involve getting your risk calculated by a breast specialist. That can be a high-risk doctor who's an internist. It can be a breast surgeon. It could be a surgical oncologist. It could be a medical oncologist. We're all capable of doing these calculations. But if your risk is better than 20%, then we would prescribe MRI for you. Average risk is about 12 or 13% for white women in America. It's a little lower for Asians, African Americans, and Latinas. African Americans, however, have a higher risk of getting aggressive breast cancer and a higher risk of mortality from breast cancer.
It's all super important information. Really appreciate you being here and sharing this with us. And you guys got the new facility there, but we're out of time today. We'll talk more.
Thank you so much, Doctor, and thank you to Baptist MD Anderson for sponsoring this segment. To learn more about Baptist MD Anderson, visit baptistmdanderson.com.